So good morning friends, today we will discuss about the previous year question. Here the first question is the agent used in the interferon gamma release assay for the diagnosing latent tuberculosis is MPT, mycolic acid, lipoarabinomannan and NEET. So here the answer is NEET. Okay. So here the interferon gamma release assay uses a specific mycobacterial tuberculosis antigen such as you want to remember these two, that is one is CFP, that is in culture filtered protein 10, and the ESAT, early secreted antigen target 6. So these have been used in the IGRA. So which is not a member of Enterobacteriaceae family, it is an E. coli, Salmonella, Citrobacter and Vibrio. You can close your answer, that is it is an Vibrio. Okay, so the E. coli, Salmonella, Citrella, Citrobacter, Klebsiella, Shigella, this all belongs to the Enterobacteriaceae, but Vibrio is not. And another you want to remember, Vibrio it is an oxidase positive. I think you know our famous mnemonic coins, right? Catalase positive, oxidase positive, indole positive, nitrate reduction and sting test. In sting test you will be using a 0.5% of the sodium deoxycholate. Okay. So here a farmer presents with a fever on and off and for the past 4 years was diagnosed to suffer from brucellosis. All of the following serological tests would be helpful in diagnosis except standard agglutination test, mercaptor ethanol test and complement fixation test and home test. So here the answer is standard agglutination test. Okay, we'll discuss. So this standard agglutination test usually detects an IgM antibody. Okay, so if it is an IgM antibody, then it is mainly for the acute brucellosis and not for the chronic brucellosis. So you can, here they have been asked the chronic brucellosis. The patient is suffering from the chronic brucellosis. So their answer the standard agglutination test. It is used for the acute infections. So in acute brucellosis, following 7 to 10 days of infection and the both IgM and IgG appear. Okay. So however what happens is, as you know, every time after the infection, IgM usually rises for some time and then falls off, and later the IgM antibody will be appearing and it will be prolonged. Okay, so that is mainly for the diagnosis of the chronic brucellosis. So in this question they have been asked for chronic, so you can for chronic, so SAT is used for the acute brucellosis, so that is the answer. Striponema pallidum can be grown in mice, armadillo, rodent and cannot be grown. So it cannot be grown. Okay. So some other such as armadillo or the 9-banded armadillo, it is mainly for the Mycobacterium leprae, that you know, I think, right? See, all of the following are true regarding the Q fever except it is a zoonotic disease. Human disease is characterized by interstitial pneumonia, no rash is seen and Wilflix reaction is useful for diagnosis. So here Q fever except question. So Wilflix is very useful for diagnosis. No. So here there is some of the point you want to remember. The Wilflix reaction, it is negative for rickettsial pox, Q fever, ehrlichiosis and bartonellosis. So always remember. So this is for epidemic and endemic typhus, whereas OX19 antibody is increased. In tick-borne spotted fever, it is an OX19 and OX2 is get increased, and in strep typhus it is an OXK. Okay, so here the answer they have been asked for Q fever. So this Wilflix reaction, it is negative for rickettsial pox, Q fever, ehrlichiosis and bartonellosis. Okay, so but it is a zoonotic disease. It causes interstitial pneumonia and it causes a, so no rashes is seen, right? So Q fever is mainly caused by, it is an organism called as an Coxiella burnetii, right? So all the options are correct. That is a Wilflix reaction. It is useful for diagnosis. It is a wrong option, so that you can mark it off. Okay.